than 500 delegates, 35 distinguished speakers. India Health and Wellness Summit and Awards brought together various stakeholders from the medical fraternity under one roof.
We at India Health and Wellness Summit believes that health is not only the matter of hospital. Health is a much larger outcome where components like air, food, water play a very important role so that we can build a greater and a healthier country.
Focusing on the topic of health and wellness and their vision for a healthy India, Karnataka was the focus state at the event, setting an example for others to follow.
Government of Karnataka has entered into an MOU with Government of India, and in the first instance we have planned to start 200 generic medicine stores in all the government hospitals throughout Karnataka. Our object is even those who have not been coming to have the treatment from government hospitals, if they want to buy medicine, they should be getting the required medicine at a cost far lower than what it is sold in the private medical shop as branded medicine. This is virtually a revolution. People have already started realizing the benefits of it, and I hope in course of time the menace of exploitation by the drug manufacturers who have been inhumanly pricing their drugs would be completely arrested.
After the lamp lighting ceremony, the summit kicked off with an invigorating inaugural session focused on convergence in health and why it is a development priority.
See, health and wellness, when it comes to your mind, everybody has its own perspective. And being a Dudwala, I'm going to look health and wellness from my food angle only. And this relationship of health and food differs from person to person in the same situation, same place. I'll just give you a small anecdote. I was just thinking, morning when having a breakfast, being a Punjabi, means breakfast to wo parathe ka hoga hi hoga. So same breakfast, same paratha, if is being served by my mother, for her, health means desi ghee ka paratha, upar a big chunk of Amul butter. She'll serve. She wants me to be healthy. And same breakfast next day, if my wife is serving, she'll make a dry paratha, और मैं थोड़ा सा मक्खन लगाएंगी तो दिखेगा ही नहीं. So this is the definition of health and the food.
एक स्टडी की गई है. The analysis show the worst quality air level is in 50 kilometers radius of Connaught Place. Of course, Delhi is 50 kilometers. They're the worst. Even we are sitting in that pollution level itself. We live here, but personally, I have left Delhi for half a month. 15 days a month, I'm not here. I can't be. I take my wife, told my children, we go out. We go to Ludhiana and to London most of the time. That's where our businesses are and we take care. We don't need to speculate the future. We need to go to a place called Denmark. They don't have traffic jams. Their pollution levels have come down. Their health budgets have come down per capita. We can save this. So this is what a typical city should look like. A safe cycling track is all that we seek. So we dream of cities like this. You need to do something dramatically and fast. Thank you very much.
मुझे लगता है कि सबसे अच्छी हेल्थ क्या है, तो पहले पूरी सांस लेना सीखो, और वो सांस आप शहर में ले नहीं सकते. उसके लिए आपने जैसे कहा, आप लंदन जा सकते हैं, आप लुधियाना जा सकते हैं. हमारे यहाँ इतने गांव हैं, तो मुझे लगता है बेसिक हमारे किसान आत्महत्या करने की वजह ये नहीं है कि उनके पास पानी नहीं है, उनके पास पैसे नहीं है. सबसे बड़ी समस्या ये है कि वो अकेले हो गए हैं. उनके मरने से किसी को दुख नहीं है, इसका दुख उनको है. मेरे पीछे कोई नहीं, मेरे साथ कोई नहीं, ये उनका दुख है. तो मुझे लगता है कुछ नहीं, एक हाथ रखना है उनके पीठ पे. ऐसे मत समझो यार मैं हूँ. सो मैं हूँ एक कहने के लिए आपकी ज़रूरत है. वो आप मैं कैसे हूँ आपके साथ, ये कहना कैसे वो आप सोचिए। बस इतनी दरखास्त है। धन्यवाद।
जो समस्या आज हम देख रहे हैं उसका प्रमुख कारण है वाटर पोल्यूशन और एयर पोल्यूशन। कुछ शहरों में मेजॉरिटी डॉक्टर्स का प्रैक्टिसेस इसलिए ज़्यादा चलती है क्योंकि पोल्यूशन के कारण हमारे स्वास्थ्य विषयक जो समस्याएं खड़ी होती है उसके कारण बार बार डॉक्टर के पास जाना पड़ता है, और इसलिए प्रिवेंटिव मेजर करके अगर हमारे लिए वाटर पोल्यूशन और एयर पोल्यूशन की समस्या अगर हम सुलझाएंगे तो सभी प्रश्नों का समाधान होगा, ऐसा तो मैं नहीं कहूँगा, पर बड़े प्रमाण पर समाधान मिल सकता है। और इसलिए हेल्थ सर्विसेज कैसी होनी चाहिए ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
Good health starts from prevention. We at Medics, the upcoming hospital that we have in Lucknow, the first advertisement that we gave was we want people who can keep the hospital empty. A lot of people had, are you starting a charitable hospital or something? I said no. But the aim should be to give best medical care and send the person as soon as possible. A profession and the idea of coming into this profession should not be just to make money. We have a very important role to play. We have to tell them what is prevention, how you can prevent yourself from diseases. You have to, give them the healthy route to good health. And that's what is today very important in our society and nation at large.
The next session talked about the importance and the right to clean air and health, and the need to protect our breath of life. Students from Shri School also presented a play on the rising levels of air pollution currently.
This is one of those sessions where we really ask ourselves, do we know what we breathe? The easiest way to check is to step outside and look at the sky and check whether it's blue. And I'm one of the first people that I would like to ask to talk about her experience here in a very different country of what this air has been like, coming in from a country that's fairly similar to us, and interestingly choosing not to be driven by her embassy chauffeur, but occasionally being seen on her own three-wheel auto rickshaw, Her Excellency Ambassador Melba Priya from Mexico.
Riding a CNG auto rickshaw would not eliminate my footprint in Delhi, but it would make it to a third of my footprint. I also breathe the Delhi air, and people were very worried that my colorful auto rickshaw would hamper my health. What I used to say is, if we are worried about the air that the Mexican ambassador breathes, why aren't we worried about the air that everybody breathes? You see, air is one of those, or maybe the most democratic thing that we have. We all breathe the same air. Why should we normalize the fact that children should stay locked up indoors? Why should we normalize the fact that they do not have to think that the sky is blue? Why should we normalize that the stars in our cities are not looked at? Why should we normalize that the healthy air makes a healthy city? Thank you.
Now turning to the politician here, what is the way that you want to bring stakeholders together to show what is possible?
See, first of all, I love it when all the attention is on Delhi. And there is a reason behind it. When we talk about all other smaller cities, urban towns, experiencing the same pollution problem. Why they are facing it? Because they are exactly replicating what Delhi has done. So Delhi is a role model. So this is the model that we have created. We have created this model that you can have highest number of cars in the city, and still there are people who are sitting here happily smiling and saying, okay, I don't want to raise my kids here, I can just move out. But then these are the very people who have actually created the mess. It is not actually poor of this city or poor of this country who have actually created this kind of mess. For example, last month when this smog thing was there and we all were worried about, there was a debate happening on a news channel. 7 participants went for the debate on poor air quality in Delhi. All 7, including me, we used SUV, single person, going and attending that debate on air quality, talked about how we need to improve our air, and then we came back in our SUVs. So it was so easy. It was so easy to put the blame on farmers in Punjab. See, the farmers are burning the crops, and that's why we are paying the price. I think it's very easy for a politician to say that, but that's not the truth.
So
we have highest number of cars, we have highest number of genset, we have highest population density. What exactly are we expecting? And it's not the air killing us, it's we killing the air and getting killed.
यहाँ का जो पोल्यूशन है, उसकी वजह से जो शहर में रहने वाले हैं, उनके पास वो नहीं है जो हमारे पास है, हम गांव खेड़े में रहने वाले। तो मैं कहता हूँ कि सबसे बड़ी बात वो रहेगी कि अब शहर से गांव की तरफ जाओ।
This today's summit is for health and wellness, and if India has to become economic superpower of the world, a nation which is unhealthy cannot become economic superpower. So India has to become a healthy nation.
Healthcare today is all about giving back the power of health to the people. The session on healthcare focused on making better lifestyle choices in order to stay fit and prevent diseases.
The panel title, Putting the Care Back into Healthcare. So first of all, I just want to open a question to the whole panel. Maybe you can tell me what are some of the key barriers in both the public and the private sectors to delivering quality care?
In a country like India, one would think that accessibility due to financial constraints would be the most important factor. We did a study, we published a study on neglected traumatic spinal cord injuries. Neglect in the form that people do not reach the definitive hospital within 30 days of the injury. And we found out that the main reason was not financial. The main reason was lack of awareness. And surprisingly, it was not only lack of awareness amongst the community, but also lack of awareness amongst the professionals. And I think this is something which can be addressed more easily with even financial constraints. If we use our resources judiciously, we should be able to have a far better India with more healthy citizens in our country.
Dr. Gadkari, I'm wondering if you can tell us, we typically think of prevention as the government's responsibility. Can you tell us a bit about what you think the private sector's role is here?
See, what we really need to look at is that prevention is the key for our country. If we think of prevention, whether it is a communicable disease or a non-communicable disease, we have good amount of resources both in public sector as a private sector. You cannot differentiate between public sector and private sector saying that, the prevention is responsibility of the public sector and treatment is the responsibility of the private sector. No, it's not so. We have to go out of the city limits and really propagate what prevention means, and maybe have awareness camps, awareness programs, awareness talks in their local language, and making them understand what prevention can do to them, how they can be benefited by prevention. And probably it's one of the most important responsibilities of the both public sector and the private sector.
Stay tuned as we get you the Indian Health and Wellness Awards 2016 after the break. Wellness Summit and Awards acted as a catalyst to find answers to affordable and accessible healthcare solutions.
In Delhi, on the TV, we see every day 450 particulates. The safe level is 100 and we are used to it. So they better be a wake-up call.
If we want to give a comprehensive health to society at large, we need to talk of these things at a platform which IHW has.
With sessions discussing the intrinsic link between clean drinking water and sufficient nutrient intake, every facet of healthcare was discussed and deliberated in this day-long event.
To develop a healthcare system in a city which hasn't seen it before, the state hasn't seen it before. And as a matter of fact, if you look at the entire Uttar Pradesh, it doesn't have multi-speciality tertiary care. So to develop that as a concept for the government, for the people, for others to understand that yes, a tier 2 city can also have a high-end healthcare delivery system. So that is something which itself as a thought process gets into a challenging mode.
हम हमेशा लोगों से मांगते हैं, कहते हैं कि सरकार मेरे लिए क्या करेगी, जनता मेरे लिए करेगी, सोसाइटी मेरे लिए क्या करेगी. कभी भी ये नहीं सोचते सोसाइटी ने मुझे इतना कुछ किया, मैं सोसाइटी को क्या पे बैक कर रहा हूँ. अगर सिर्फ इतना सोच लें कि हमें पे बैक क्या करना है सोसाइटी को, बहुत सारी बीमारियों से हम बच सकते हैं.
Our young parliamentarians also left no stone unturned in bringing forth their vision of a healthy India.
I'm talking about empowerment. Malnutrition in Shopur district, in my state, we just lost 65 kids to malnutrition in one day. I spent 2.5 days there. I went to NRCs, which were 20-bedded NRCs, which had 120 kids on those 20 beds. And that's a district where 200 crores per year is given for malnutrition. I asked them what is happening. The block development officer came, the minister came, made a statement in Bhopal, no malnutrition deaths in Madhya Pradesh at all. Where is the accountability? And I think that's the question we need to ask of our system. And I think if you can resolve that conundrum, if you can act as responsible citizens, whether you're a bureaucrat or you're a politician, admit to your mistakes and say, okay, we're going to correct the process going forward. That's the way to take our country forward.
What Mr. Scindia said, I completely agree with him. There has to be a societal change, and for that, India needs social leadership, which it does not have. Zilch now. We are only banking on politicians for everything, for all kinds of ills. So, if you want to bring in a change in, say, the healthcare system, for one, I would say that instead of focusing on HIV or on certain other things, we should focus on local diseases. We should focus primarily on population control. Today, many state governments in India, across the country, I heard, they give special funds, they allocate special funds to pregnant mothers. So, indirectly, we are encouraging a growth in population. When you are falling apart with such basic level of governance, then how do you expect healthcare can succeed? So these are issues that parliamentarians should discuss about.
On one hand, there were young startups discussing how to fix India's health woes, and on the other hand, the summit saw the pre-launching of the Medics Superspecialty Hospital. A hospital that brings with it an experience of more than 2 decades and promises to deliver unmatched healthcare services.
I think the people simply need to understand healthcare is as important as their daily needs. Mobile, car, house. We have priorities in life, but healthcare seems to be getting low priority. I ask everyone to invest in healthcare. Their personal health and national health will improve.
The event culminated into a gala award ceremony, an evening that celebrated and awarded the best in health and wellness.
Our first category is in the category of Health Insurance Brand of the Year. And the winner is Apollo Munich. next category is Health Brand of the Year Air. And the winner is Philips. In the category of Ayush Brand of the Year, the winner is Amul. Our next award, Health Startup of the Year, and the winner is Medicover. The last category of the day is Emerging Hospital Brand of the Year, and the winner is JP Healthcare.
Here we recognize the work of all the industries, air, food, water and healthcare, and we encourage startups, entrepreneurs to come forward, show their work and tell people what they are doing good for the society, and we request everybody in the industry to come forward and tell what they are doing good, and we would like to recognize their work.